Well, a little earlier in the show, we looked at a study by the University of the Western Cape, which found that amongst overweight women in South Africa, there is a perception that being overweight meant that you are healthy. Now, with spring just around the corner, we decided to look at how South Africans view weight loss, food, and all that goes with leading a healthy life. We're joined this morning by our resident Dr. Darren Green. And of course, if you want to weigh in on the conversation, then you can give us a call live, 021-430-9881. Dr. Darren Green, how are you?
Good, thank you.
Looking mighty healthy, so you got a glow on your skin.
And did you guys call each other because you're literally twinning right now?
Totally dead.
Telepathy.
But let's get into this, Dr. Green, because you're involved on the ground and you see patients and you speak to people about their health on a daily basis. Do you think that we as a country are moving in the right kind of direction in terms of trying to teach our children and teaching our people to be healthy as a nation?
I definitely think there is a shift that's occurred in terms of awareness around the links between your weight management and non-communicable diseases. Big mouthful, but basically your lifestyle diseases. Things like hypertension, diabetes, and cardiovascular disease, which are some of the biggest killers of people in our country and worldwide.
Yeah.
So I think that's where the issue comes in. So people are more aware of the association of weight regulation and these lifestyle diseases, certainly.
Okay, so I know that government wants to implement a tax, what is it called? A sugar tax. Does that say to us that they realize that something needs to be done about the amount of sugar that people are consuming? And also, is that the answer? Because usually when something gets made more expensive, we just continue buying it because we haven't been taught to live a different way. Yeah,
that's exactly what the debate says. The debate around implementing sugar tax includes points like, is it going to obviously affect the poor the most in our country?
Yeah.
And if you think about it, you know, the initiative of riding the message home in terms of sugar causing, health complications is something we need to get across. Implementing sugar tax obviously will make it less accessible to a portion of the country, but those that can afford it are still going to carry on. So our community education needs to happen at a really early stage. Teachers and schools need to become involved at a much earlier stage, and we need to start obviously in our families as well about understanding the role that food plays in our lives.
Yeah. And of course, I think having role models, sorry, you were going to ask a question.
I just want to say, instead of making sugar more expensive, why don't we make healthy food more affordable?
Yeah, good way of looking at it.
Oh, Minister of Health and whatnot.
Grow it. Why don't you just grow it yourself?
Exactly.
Teach people to do that, yeah. I was going to refer to somebody who is not possibly everyone's ideal role model, but to some people, he really is a massive role model. Julius Malema.
Correct.
There was a time when he was particularly round, and then he went to the less rounded phase of himself. And a lot of people had this perception that, oh, he was sick and whatnot. You know,
Correct.
And that's one thing that the professor mentioned, that in our communities, if you are overweight, it's seen as something to be respected, to be admired.
You're affluent.
How do we change society's mindset that if somebody goes from being big
curvy,
to slender, that doesn't mean they're sick?
Yes, it doesn't mean that you're suffering from TB or HIV or anything like that. So what we need to understand, obviously, is that sitting is the new smoking, and moving and the ability to move without causing damage to your body is very important. You can imagine moving a body that is 20 to 50 kilograms overweight around, taking that upstairs, the load that puts on your joints, on your ankles, on your hips, and obviously the stress on your heart to move that around is quite tough.
Yeah, if Julius can speak about a healthy lifestyle and be an ambassador for that, we can all do it. Come on.
Here, we can all do it. Well, we're talking about how South Africans view weight loss and, of course, how this affects our weight loss. So if you want to weigh in on the conversation, you can give us a call on 021-430-9881.
It's my feel-good breakfast show.
Tell you what, we're learning new things, eh?
All the time.
Midnight feasts. Welcome back to your Feel Good Breakfast Expresso on SABC3. We're talking about a very important subject indeed, that of obesity and our health connected to that. We as South Africans being the most obese nation in sub-Saharan Africa, and something that we really need to have a look at. So let's quickly shift our focus now to our view on food as South Africans. And what do you make of that?
Yeah, why do people eat? Some people see food as a comforting emotional tool. And when you're often depressed, you often eat more. When you're anxious, you sometimes eat less, interestingly enough, because of the nerves and that butterfly feeling in your tummy and the acid that's being secreted and so forth. So that's important. But, you know, also viewing the role of food. Do we eat because we like the taste of food? We enjoy the experience. It's a multi-sensory, flavor-filled experience. Or are we eating because we actually need the specific nutrients to carry out our daily tasks? So the mindset of what and why we eat is very important to go and analyze. And we need to answer those questions because each culture, each home, each family has different viewpoints as to why and how they consume food.
Yeah, I've got to say, honestly, I eat because I'm hungry and it's delicious.
Oh,
I don't think about the nutrition.
Of course. Well,
So the taste is important to you?
I think that I was always on the back foot when it came to food because I am an emotional eater. It does control a lot of my happiness as well.
course,
So I eat
yeah.
when I'm happy, I eat when I'm sad, I eat when whatever. And then also culture plays a massive role in my
indeed.
relationship with food. How I grew up and what role it plays.
Yeah.
We grew up with very carby food. Vegetables were like potatoes. It was like potatoes and sweet potatoes. in
Potatoes
like
were
butter.
vegetables. Potatoes are regarded as really
Yeah,
healthy
that's your
vegetables, you know.
vegetable.
So Sunday lunch menus now need to change because we need to like change our culture in our
traditional.
homes, right?
Yeah, I mean, we have like 6 or 7 dishes, actually about 6 or 5 main courses. In certain cultures, that's the norm every week. Everyone brings their pots together to socialize. But we're not looking at the balance in terms of what we actually have there
Exactly.
and what the calories are contained in which food stuff.
So
We
if
don't
you're-
know that.
Yeah, if you're an adult today and you grew up viewing food in a certain way because of your culture, I mean, where does that leave you now?
It's really, well, we obviously have dropped the ball because if we look at the increase of 20% from 65% of South Africans being obese to 85%.
Sure.
We've dropped the ball and what we were doing wasn't working. And worldwide, even the warnings from the WHO have shown that we need to obviously become aware of the portion sizes. Do you eat until you're full or do you eat what you need to maintain your target weight and what you're burning?
Yeah.
Yo, as long as I can still smell that fried chicken in the kitchen and it's still warm and wafting through the living room,
Oh, mama's chicken.
I am going. Do we eat too much meat?
We eat a lot of red meat in South Africa. The big thing is the fat content of meat and which fats. You get plant fats and animal fats, and obviously you need to understand that. But understanding that fish and chicken obviously are very healthy for you, just because of the fat content regulation, provided you take the skin off the
Yeah,
chicken.
yeah.
But in meat specifically, processed meat, and we love boerewors and boerewors rolls, the association of processed meats and things like gout, uric acid levels that are raised is very important to note.
Okay.
I love it. Well, I think in order to make a real change, a meaningful change, you've always got to know where things began, what the root of the problem is, so that you can address the way that you know,
Correct.
kind of your relationship with food. We are talking about South Africans and the relationship with food. If you have something that you would like to say, weigh in on the conversation. That number to dial is 021 430 9881.
It's my feel-good breakfast show.
All right, back again with Dr. Darren Green. 021-430-9881. That's the number to call, just like Magda, who's on the line right now. Good morning, Magda.
Good morning.
Thank you so much for your call. What's your question or comment?
Good morning. My comment is that I was in Norway, me, my child and my son, my daughter, my son, and 3 other friends. And we were in Norway. It's a first world country, but the comment that I want to make is that people there cook their own food. They move around a lot. We stayed with somebody in Norway, from Norway.
Yes.
And eating out is so expensive that you have to cook your own meat, your own food. And then we had to walk everywhere we wanted to be.
Wow.
So the comment that I want to make is we came back later. I lost like about 4 kgs in the 2 weeks that I was there. Because
incredible.
they walk, the transport system, okay, number one, it's a first world country.
Yes.
It's so good that everything was in walking distance also.
Yeah.
And because they are it's mountainous there, you actually have to walk up hills and down and everywhere. you wanted to do.
So, Martha, I guess what you're saying is that as a society, Norwegians are kind of used to the idea of moving and having a physically active lifestyle as a norm, which is something that we need to change. But a lot of people think that being active means going to a hardcore boot camp and but it doesn't have to be that at all, right?
It's just about raising your heart rate to 80% of your maximum heart rate to get the heart muscle fit. But the problem is some people see exercising as a license to eat more.
Yes.
Ooh.
So because I train today, I'm going to eat some extra fries or whatever. So yeah, which isn't incorrect in the sense, but they're not looking at the nutritional value of what they're eating.
Yeah.
So the issue is just they're training to sustain their eating habits.
Yeah.
You understand? It's not a mindset change.
Exactly. I think it's just a matter of changing your perceptions around movement and activity. It's not about going to a gym. It's about just being active in your daily life.
Go play football with your friends.
Sitting is the new
Take the
smoking. I mean,
stairs.
that's the study that's come out. Sitting is the new smoking.
Yeah. Listen, I wish we could engage a bit more on this topic, but I know we will be back again next week with another health chat. And you're
Yes.
available on
Fantastic.
social media as well, right? If people would like to engage with you there.
the
Thank you
socials.
so much to Martha and for everybody who engaged in this conversation, one that is really, really important to have, especially as we look forward to building a healthier Mzansi.